According to the Ministry of Health, over 75% of adults and 90% of children in Uganda suffer from the oral health issues such as the tooth decay annually. Dr Naftali Nabaasa, a dental surgeon from the Oral Health Uganda, blames the increase in the dental diseases among the children and the adults on a number of issues, including the consumption of the sugary food and the poor hygiene.
If you can spend 2 to 3 days, for even a month or even a year without brushing, without flossing, just know that you're giving a conducive environment for tooth decay to occur in your mouth. Then second, we talked about, of course, germs that we said they occur in our mouth. Then we said feeding on sugary food products. Sugary food products like, of course, yogurt and any other kind of processed sugars are the leading cause of tooth decay. In children, for example, we say that sharing toothbrushes can be a way of how these microorganisms or germs are spreading from one person to another.
In addition to consuming bad sugars, Dr Nabaasa also stated that many Ugandans have poor brushing habits. He describes the right way of brushing as drawing zeros on one's teeth.
Your toothbrush on the gum line, where our teeth are joining the gum, we call it just at the gingival line or the gum line. Press your toothbrush, let it be covering at least 3 to 4 teeth. The bristles of your toothbrush should be covering 3 to 4 teeth away or immediately on the gum line. So make back and forth strokes, at least like 4 of them, back and forth strokes, and then sweeping down. We are trying to remove this food debris away from our teeth and then take them out, not just mixing them with saliva and then on our tongue, So when it reaches on, of course, on our anterior teeth or the front teeth, we are going to change the angle or the position of how we hold the toothbrush. You need to have opened your mouth fully.
Dr Nabaasa advises that one uses a soft toothbrush instead of a hard one, explaining that hard toothbrushes should only be used when prescribed by the dentist because they can injure the gum, which can lead to infections.
Major timing and the time of how we should be brushing is you should wake up very early in the morning, eat your breakfast, take a shower. After taking a shower, of course, and eating, let the brushing be the last option before you go to your job. So when you reach at your job, you're now at your job and you've eaten your lunch, just rinse. We advise someone to just rinse. You would have removed all these food particles before they harden. Rinsing with water, not any other thing. Then another brushing should just take place that evening before sleeping, before bedtime.
The dental specialist warns that once the above precautions are not taken into account, dental treatment may turn out to be expensive, with charges on open market in University of Kampala averaging at around 200 shillings.